Hello everyone, today we meet again in a topic of great interest, especially for patients who are treating lipid disorders, which is to learn about the drug ezetimibe. After watching this video, we will have more in-depth knowledge about the drug ezetimibe, which will help us use the drug ourselves. Now, let's get to the main content right now. Now we will go into the mechanism of ezetimibe. First we will learn how cholesterol from food is absorbed into the body, from which we will easily understand the mechanism of the drug. We need to understand that plasma cholesterol comes from two main sources. The first is the absorption of cholesterol from the diet, and we can regulate the amount of cholesterol in our diet. The second is produced by the liver and peripheral tissues, and we can hardly interfere with this process. Now that we understand where cholesterol comes from, let's look at the complex process that takes place in the intestines to absorb cholesterol into the blood. Dietary cholesterol combines with bile acids to form micelle complexes and moves through the intestinal lumen. When the micelles reach the enterocytes, they are hydrolyzed and absorbed by Niemann-Pick C1-like 1 in the enterocyte membrane. Cholesterol, after entering the small intestinal cells, will be esterified and incorporated into chylomicrons, cm, and secreted into the lymphatic system. Once in the lymph, they are drained into the plasma, where lipoprotein lipase activity degrades the triglycerides and becomes a remnant in the chylomicrons, which are eventually taken up by the liver, by the low-density lipoprotein receptor or LDLR-associated proteins. After understanding the process of cholesterol absorption from food, we will continue to learn about the mechanism of the drug ezetimibe. The mechanism of action of ezetimibe is based on inhibition of intestinal cholesterol absorption by selectively blocking the NPC1L1 protein at the jejunal brush border, which is integral to the uptake of luminal micelles into the small intestine. The exact mechanism by which ezetimibe reduces cholesterol uptake into both the small intestine and hepatocytes is not fully understood. According to some studies, ezetimibe can change the shape of NPC1L1, making it unable to bind to sterols, or can interfere with the binding of free cholesterol to cell membranes, thereby inhibiting the absorption of cholesterol in the intestine. By reducing enterocyte cholesterol absorption, chylomicron formation and secretion, as well as the back flux of cholesterol from the bile, ezetimibe depletes hepatic pools of cholesterol and increases expression of the LDL receptor on the surface of hepatocytes, resulting in reductions in serum levels of LDL-C. Ezetimibe does not appear to affect the absorption of dietary triglycerides, fat-soluble vitamins, or drugs such as warfarin. We will now discuss the indications and efficacy of ezetimibe in clinical practice. The drug is indicated to reduce cholesterol, low-density lipoprotein, LDL, treatment in patients with primary hyperlipidemia, mixed hyperlipidemia. In addition, the drug is also used in some cases of familial hypercholesterolemia, HoFH, and homozygous cytosterolemia, phytosterolemia. A pooled analysis of 8 randomized, placebo-controlled trials including more than 2,700 subjects showed that monotherapy with ezetimibe 10 mg daily in subjects with hypercholesterolemia, for at least 12 weeks, significantly reduced LDL-C by 18.5% compared with placebo. In addition, there was a significant 3% increase in HDL-C, a significant 8% decrease in triglycerides, and a 13% decrease in total cholesterol, with ezetimibe compared with placebo. Now we will learn about the pharmacokinetics of ezetimibe. This content will help us know how to take the drug, what we can eat during the time of taking the drug. First is the absorption phase. After oral administration of ezetimibe, the drug is absorbed and conjugated to ezetimibe glucuronide to produce pharmacological activity. Mean peak plasma concentrations of ezetimibe glucuronide are achieved within 1 to 2 hours. Blood concentrations of ezetimibe are increased by 38% when taken with a high-fat meal. However, the extent of absorption is not affected by taking ezetimibe with food. Therefore, ezetimibe tablets can be taken without regard to food. This is followed by the distribution phase of the drug in the blood. Ezetimibe and the ezetimibe glucuronide complex are more than 90% protein-bound. Next comes the hepatic and renal metabolism of the drug. Ezetimibe is rapidly metabolized to ezetimibe glucuronide. Plasma concentration time profiles exhibit multiple peaks, suggesting enterohepatic recycling. CYP450 metabolizes ezetimibe, and ezetimibe has little effect on the pharmacokinetics of other co-administered drugs, because it is rapidly conjugated and excreted in the bile as the glucuronide. Finally, the phase of drug excretion from the body, ezetimibe is eliminated from plasma, with a half-life of approximately 22 hours. Ezetimibe is primarily excreted in the feces. Because of the long half-life, the drug is only taken once a day. Thank you for watching. Don't forget to like and follow the channel to update useful medical information.